So we've kind of hit through this series and this course. We've talked about vulnerable populations. We've brought up socioeconomic status. We've brought up communities of culture, indigenous populations, and so this talk is kind of trying to tie all of that, where you can see the interconnectedness of climate change and kind of our healthcare system and kind of more of a worldly component, how this all interrelates. So I want to try to tell you that story so we can understand how climate change and health and racial inequities kind of go together. So what we're going to cover today, we're going to buzz through the climate science stuff. We're going to go through that in like 60 seconds because we've already done that. But we're going to talk about colonialism and how that aspect. So we're going to do a little bit of a history lesson here. And then we're going to impact, how climate and race and health are all impact, but we'll also talk through some solutions because we always want to be talking through solutions for this stuff. So we know climate change is about the story of carbon. You guys have seen that. So we know that carbon was really high a long time ago, but it has now come back down and then started to re-rise as we hit the Industrial Revolution and started consuming fossil fuels. So we're changing our carbon cycle. We're throwing more uh, stored carbon into the atmosphere. That's causing our extreme weather and temperature elevations and everything. We've talked about greenhouse gases. We've talked about what sectors they're in. And those sectors are going to come into play when we say, where are the transportation lanes? Where is the industry put in? So our carbon cycle is out of whack because we're consuming these fossil fuels. We've energized our planet. All this energy is going and creating that extreme temperatures and extreme heat. And those are our four main mechanisms. And we have done climate in less than 60 seconds. Cool. You guys did a whole major in 60 seconds. Just a quick review, right? So we've already talked about that. I don't think, does anyone have any questions on our basics of climate change since we've already talked about that? I'm pretty sure no. Part of that's because I do this lecture to have that as a basis for other people when we haven't had this in-depth conversation on that. So knowing that our climate's changing, we say we're going to have that as our basis. How is climate change, leading to racial inequities? That's kind of our next thing. How is this magnifying, or how is this part of the story? So to look at that story, we need to go back and understand the concept of colonialism, right? So where did this all start? Well, people, because we're such a great species, have been enslaving people for years, whether that's the Romans or the Greeks or the Assyrians, the Persians, right? We have been enslaving other people, making them do our work, benefiting from that because that's what we do
About
as
talking about
humans.
that.
And
No,
so
but they're like changing it to where like the
I just muted Mika. Um, so that's been going on for years. What really changed is in the 1500s, we took this to a scale of like greed and genocide that had not really been seen in past periods of time, right? And so what was happening? European countries wanted more, right? They wanted more wealth, they wanted more resources. They were starting to use up what they had in their countries and what their trade routes could do. They wanted more. So where were they going to go? They needed to go somewhere beyond Europe and they wanted to take it, right? So colonialism is the economic exploitation of a land benefiting the colonizers, right? This wasn't a one-way trade. They weren't be like, hey, we're going to give you some of this and this. No, this is a one way. It's coming right back to Europe. We want to take all the wealth and all of things that we can to make ourselves wealthier, power, right? It was a power grab. So when we think about that, what did that look like? It started with the Columbian Exchange. So the Columbian Exchange happens, right? It was all about trying to get gold and silver out of the Americas and bring it back into the coffers for the kings and queens in Europe. But in this exchange, they found other things. It wasn't just gold and silver. They found fruits and vegetables. Animals like pigs came from Africa and found that pigs do really well in the Americas and were growing. And so this exchange of goods started to happen. Before this happened, right, tomatoes were an America's thing. There wasn't pizza in Europe, right? There wasn't like, we start thinking of what is culture, what is stuff. The Columbian Exchange was our first trans kind of continental major exchange routes that happened. right? The good news is this was a two-way street, right? So the Cree nation runs most of America, right? Because they got all the goods too. No, this is a one-way street, right? It's getting sucked into Europe. All the trades were positive for that. Well, it turned out as we kept doing these trades, we're like, we need some workers to manage this. We need some people. So, right, Virginia and some of the colonies in the United States were founded by like 18-year-old frat bros, right? They didn't have skill sets. They wanted money and they wanted power and they had a lot of testosterone going on. So they come over and try to farm this land and they have no idea what they're doing, right? They're trying to grow animals and look for gold, but they can't figure it out. So, trying to figure out how to live in the Chesapeake watershed. We talked about there was malaria and yellow fever. But what did happen is you're like, well, I don't really want to work this myself. I'm a white dude. I need to get other people. Well, there's a thing called indentured servants, and we started using indentured servants. Why? Because indentured servants were cheaper than enslaved people at the time. The problem is most indentured servants were trying to come over, going to work for a few years, right? And then they would go off and they could get their own piece of land and take it from an indigenous population and then create their own wealth factory. Well, a lot of those indentured servants said, I'm not going to wait for 3 or 4 years. I'm just going to like take off whenever I can. And so some of the initial colonists were losing indentured servants at a rapid rate. So the price margins for what an indentured service cost versus an enslaved person started to change. And so the indentured servant cost kept, or the slave people kept getting cheaper and cheaper, and indentured service kept getting more expensive. So it had that flipping of where it was initially. The other thing is if an enslaved person from Africa ran away, they looked different than me as the white colonizer. Guess what? I know that they're not an indentured servant. I know that they don't own that land. So the slave trade starts to come in, and we start switching from indentured servitude to slaves. And why do we need slaves? Because I want people that I don't have to pay and I can maximize my profits. And so it's more than just the Columbian Exchange. We now start producing higher value products. I don't just want sugar cane. I want to produce the sugar with my slaves, sell that at a higher level, get it back into Europe. Same thing with rum and cotton. And we started the slave trade, right? We were bringing goods and services from the United States to Europe, and slaves were coming over to the Americas as part of the cheapest form of labor and maximum profits. And the cool part was it wasn't just if you just owned a slave, right? You could make money on that, but you could go to the London Stock Exchange and buy and invest in slave companies, right? You could invest in them and make money as a banker in London without having to be involved with the slave trade at all. Aren't we a wonderful society? Yep, that's what we were doing. So check your portfolio, right? Make sure you're not in slave trade companies. So how did this progress, right? So we started seeing the world, as Europe was just carving it up and saying, well, what resources can I exploit from you? And so looking at colonies and not seeing them as people, not seeing them as an ethnic group, not seeing them as the land of something of value. They wanted what was in the land. They wanted the resources. And how do you get that back to Europe for money as fast as possible? They started carving up borders, right? It wasn't a border that was like this, nation versus this nation of people. It was just carve it up wherever we want. We want to get things to the coast as fast as possible because everything was ship traded, right? So I'm going to not really do any investment in my infrastructure in the company. I'm going to suck up whatever I can, make a beeline to the coast with the, little rail system, get it to a ship and get it out. There, we're going to go through whatever we need to go through, cheapest, easiest, maximize profits. That was what we're seeing, right? So there was no infrastructure investment. And you're taking away natural resources from places that had natural resources, right? And natural resources are a source of wealth for anyone. So you're depleting wealth and you're not providing infrastructure and you're taking people and separating countries, right? So colonialism is a destructive force. The good news is we've stopped doing this, right? Maybe not. Now, right, we're looking at renewable materials. Like I need copper and cobalt and manganese, and I can make batteries with this stuff. Aluminum. This is from like the US government where we have given aid. Where the aid from the US government goes, There are certain places that we give money that have certain resources. I wonder why we give them money. Maybe so we can get the resources from them. Hmm. So it's looking at even green materials now. We have a different kind of colonialism. We're going to more of a hmm, green colonialism, but it continues today. And some of the problem is, say, I want copper, lithium. These are things that we need for climate change and some of our solutions that we're proposing. But the areas where we're going to get the copper, where we're going to get the lithium, are areas that are also stressed from drought. Copper and lithium mining requires a lot of water. So we are taking a place that already is short on water, mining them, taking away a resource that is water intense, and removing that. So we're taking away not just the resource, we're taking away their water, which is going to affect these countries that are less resilient, right? We're affecting them in a colonialistic manner at now a different level, right? So it's not just the mineral, we're taking away water, which is a livelihood for things. So what is colonialism creating, right? You get a destabilization of people in the global south. We get unequal access to resources, political representation, and treatment. So you're getting subjugation, segregation, destabilization. And then because you've created these colonies, to try to grow a nation, to decolonize, takes time, right? You have to then go and throw off your oppressor, your colonist, get rid of them. But now I've thrown off that oppressor. I don't have the resources anymore. They've already been taken. There's no infrastructure. The infrastructure was just to get resources out of this country. We don't have roads. We don't have parks. We don't have schools. None of that was built, right? Now we have multi-ethnic groups in these borders that the colonists just kind of, created. So these are not ethnic groups that maybe were happy with each other and they had their own kind of nation states separate, but they've been pushed together with that. They're also trying to legitimize themselves as an economy, as a social entity. How do you nation form? How do you create that nation? And then to say, okay, I'd like to go to the, World Bank and say, hey, can I get some money? Well, guess what? There still exists in like the World Bank some racism, some intolerance, some xenophobia. We're not going to give you money or we're going to give you predatory terms. So you've already been disadvantaged economically because you don't have the resources to sell. And now you can't even get loans because the people you would go to get loans for are your former colonists. So the cool part is it wasn't just that kind of destabilization, right? It's the frat bros coming over. Guess what frat bros do? They like to have sex and they wanted to have sex and they had sex with enslaved people, indigenous people. And through those relations, we created a whole different issue, right? You're no longer a pureblood Portuguese. You're not a pureblood Spaniard, right? We have Creoles, we have mestizos, we have mulattoes, right? They're all coming out of different relationships that the colonists are having. At this point, the Spanish casta system in Spain was like, this is not good. The Catholic Church, we have a hierarchy. We don't want the pure blood. We don't want it changed, right? How do we manage this? Well, we'll come up with the casta system. And so this was the first, because people couldn't read, pictorial representation of the casta system, basically creating a system of hierarchy. And this said, based on whether the male or the female, what their, in a sense, ethnic or race was, and different races had different hierarchy levels. So you were ranked one, two, three, in a sense, who is above who in the society. This was also written into law in Spain and Portugal. They said, well, we don't want Catholic priests being mulattoes. We don't want Catholic priests being Creoles or of any mixed race whatsoever. This also went for Spaniards who were Jewish or Muslim who converted to Christianity. They could not, they were written into Spanish laws. No, thank you, the Spanish Inquisition with this and Catholicism, but it put this structure into place. This was then passed down, not just in our Europe nations, but also in the Americas. This caste system was projected there. Part of the problem with the caste system is, okay, I'm going to decolonize. I'm going to throw the number one people in the caste system out. Well, if I'm number two in the system, I don't want to, I would be top. Do I want to get rid of the system? No, it benefits me. So it becomes this perpetuating system that is made into law, and it's something we even see today. Isabel Wilkerson wrote on this a really nice book talking about the impacts of caste system in different societies, right? And so one of the things she even comments is being in a lower caste over periods of time actually has health outcomes. Because imagine if you are under the constant, we've talked about stress and what that does to our body, both hormonally, mental health wise, and everything. If you're under the constant stress of prejudice over periods of time, you have worse health outcomes. You have more high blood pressure, more mental health issues. That stress leads to adrenal insufficiency at times. You can have diabetes. Things like that from a chronic stress state are built in because of this caste system. The good news is, at least in 2022, the IPCC, this International Panel on Climate Change, came out and actually acknowledged that colonization is a huge cause of climate change and ongoing vulnerabilities in our populations today. The inequity, marginalization, and historical and ongoing patterns of inequities such as colonialism and governance. And so we are at least acknowledging that colonialism is a leading cause of climate change with depletion of resources, instability, segregation of people, changing of their mental health, impacting their health. Not good. Any questions on colonialism and how we got to where we're at today? Cool. So we have this racial inequity, right? We have people that we have said are inferior for whatever reason. We've put that into a system, a caste system. Okay, we have racial inequities. Is there health issues with that, right? That's the next question. Okay, if we have this colonialism to racial issues, do we have a health system? Well, we're going to look at this from like social, political, commercial. All of those determinants of health are important to understand how racial inequities are leading to human health issues. So let's just look at per capita consumption of carbon, right? So this is like looking at carbon use per person, right? So we talked about China is the number one overall producer, but we in the United States are per capita, per person, the most CO2 emitter. So you can see there's kind of a trend, right? If you look at who's consuming or who's producing the carbon, it's usually the colonizers, right? It's those people who have been extracting wealth and producing and consuming goods. We see consumption and fossil fuel use go hand in hand. Thus, consumption and climate change go hand in hand. So as they're taking resources from the south and using them in the north, right, we're seeing that they're the ones who are leading to CO2 emissions. And we start to get this divide where you see the global north and the global south. A lot of this is based on colonial practices over time. The global north only makes up 14% of the population, but it produces 92% of the carbon. Significant inequity, right? The global south produces little carbon, but feels most of the impacts of climate change. So how do we, kind of rectify this on a global scale? Well, the global north has a different kind of how do we get to climate justice and make this fair? They have kind of a solidarity, and I think everyone should share the impacts of climate change fairly. Well, you're the producers. Why do you want it necessarily fairly? Which means, I guess, everyone does pitches in. You need to be pitching in more. The Global South has kind of a different view. They have kind of a Bali principle where every country has the right to be free from climate change and impacts. They're not the ones making the CO2. They're not the ones consuming, but they're taking the impacts. And they, for doing the best they can with their carbon emissions, should feel that they should be free from those impacts, not just from climate change, but the health impacts that they're feeling. So with this like global south, global north, why is this existing? Like what is one of these compounding things? Well, I want to talk about kind of two concepts of a life economy versus a death economy. So a death economy or an extraction economy or a linear economy, however you want to describe it, leads to extraction of whatever that resource is, processing it, distributing it, consuming it, and it's gone. So, simple example, I need to run my vehicle. I suck oil out of the ground, I process it into gasoline, I put it in my vehicle, it is gone. It has been consumed and no longer exists in the form that it started. And I can't reuse it. I can't capture that carbon and put it right back in. When you get into that, right, if you lead to a cycle of continual extraction, there will be nothing left, right? All you're going to do is take and dispose, not necessarily a truly sustainable manner or way to continue to process goods, to use goods in that kind of manner. The alternative would be a circular economy, a life economy, where we're trying to initially take whatever we use, right? We pull something out of the ground, we produce it, we consume it, and then in our disposal phase, we look for a way to repurpose it and put it back into the cycle. So I pull out copper, I pull out aluminum out of the ground, I turn them into a solar panel, I generate electricity over a period of time. The solar panel is no longer working. I now break down the copper, I break down the aluminum, and I melt them and remake a new solar panel, or I turn them into a battery or use something else. This is kind of a circular economy, a life economy, where things lead to, at a certain state, I don't have to extract as much, right? If I continue, I have extracted enough lithium out of the ground to run all the batteries and do everything, we eventually reach a steady state where I don't have to extract as much lithium out of the ground. So it's looking at these concepts and saying, which kind of an economy do we want to live in? Which kind of a way do we want to manage goods and services? Why is this important? Right? So if we look at like a global north, global south, how do we change these colonial practices? How do we change our economies to get to something more sustainable that we're not impacting health and putting these untoward outcomes onto patients that are not even producing the issues? So this is looking from the New England Journal of Medicine, looking at where the health differences are in the global north, global south. A is looking at the darker red versus the green, is talking about how many parts per million of CO2 is being produced per capita. Again, global north producing it, but 98% of the deaths from climate change occur in the global south. So we look at deaths, whether it's diarrheal illness, malaria, heat-related deaths, and then undernutrition, higher percentages in the global south. They're the ones bearing the burdens of climate change on this effect. And the problem is the indigenous populations, those that have been colonized, are trying to get out and trying to manage this, but they are limited in terms of their impact because they are not the CO2 producers, right? I can lower my carbon footprint all I want in my country, but if I don't produce a lot of carbon compared to other countries, it's not going to make a global impact for me. So as we see these health differences, we have certain communities that evolved. But are there studies on this, Brian? Like, are you just making this stuff up and like, oh, this is great theory and stuff? We look at like race and ethnicity. There are specific studies just looking at that factor. Over 13 studies have looked at this, showing significant differences in heat exposure and PTSD in communities of color. Maybe it's migrant communities. There was over 10 specific migrant climate change studies looking at their exposures, and they're more prone to live in a flood zone. They're more prone to be exposed to heat island, maybe have a poor diet, less access to care. These are things that these communities are being exposed to disproportionately, which we would say also hurts their health. Indigenous populations, there's over 8 studies looking at specifically at indigenous populations and climate, and they notice respiratory, mental health, reproductive health, dietary consumption, and dietary complications, infant mortality and malaria are more common in these patients. So, because of our colonial nature and because of what we've created in the world, certain populations are at more health risk than others. And this is beyond just race. There's a gender component to this too. And these magnify. So if I take gender and race and magnify those together, there's even more health inequities and power inequities. So, two examples: Uganda. Uganda women had a huge value and role in society. They were some of the best farmers. They knew how to manage the fields, they had better yields. If you look worldwide, women manage farms better than men. Women have more profits, less or higher yields in their crop, and less loss of farmland over time, right? They are better managers. Uganda knew that. They were doing that. Colonists came in and said, you know what? Women need to be cooking. Women just shouldn't be in the field. Made that difference. Changed the society. Guess what happened? You got a double compound, right? Women went from a societal role, they lost that, and then they took the brunt as well from the colonies taking of resources. So it hits that. The Philippines had the same thing. Women were marginalized when the Spanish came in and took them away from their role in society. And in doing that, they had less access to reproductive health and had more pregnancy complications right afterwards. So when we look at changing kind of some of these inequities, we have to look at how many factors can be impacting these people. Income, we've talked about that, right? So if I'm lower socioeconomic income and of a different race than a colonist, I'm going to have increased health disparities, increased power inequities, right? And we see this in their heat exposure, heat related illness, less green infrastructure. We'll talk a little bit about that. But globally, this is a big issue. So colonization leading to racial inequities, we are now seeing significant impacts in the global south compared to the global north from climate change. Questions on that? Cool. Keep going. I want to bring up this concept of intercolonialism. This is kind of unique for the United States because there's not many places that were founded as a colony that then became a colonizer. You don't see that. But we've kind of colonized not just within our country, but externally, right? But we've colonized parts of our country for certain things. So let's look at even how we're exploiting parts of our country and where it all started. Well, remember, our system was started by these college bros that came over, right? And to have our society work, we had to have structured racism built into our society, right? We are not where we are today if we didn't have slavery. We have built this into every law. And when you have structured racism, it is implicit in the entire societal management, whether that's earnings or credit, healthcare, criminal justice, housing, education. You can't just remove it because it is so built in. We have built wealth and done things in this country all based on the backs of free and poor people. Who do we send to war? Poor young men of color. We do this over and over again, right? We have this built into the fabric of our society. It's not fun to look at, but we have to acknowledge it and understand we got to where we are today based on this, right? So when you have structured racism built over years, right, we had this plantation society, but the good news in the 1800s, we said, we do not want to be a plantation-based economy. We are going to free our slaves, and we will never have colored people work in the fields again in America, except every farm in the United States today, right? Have we really switched, or have we just changed what we call it? Let's look at the concept of redlining. Does anyone know redlining or heard of redlining before? But we're going to get into this today because this is part of that structured racism, the systemic racism that was built in our country after a period of time, right? So the 1930s are happening, depression, right? This is not good, right? Depression, lots of people are unemployed. We're seeing banks maybe failing. People can't pay on their homes. this is not a good, right? So if people can't pay on their homes, it's going to worsen banks. It's going to be bad for the economy, bad for our system. We don't want more homeless people. We don't want anything like that. Well, the Homeowners Loan Company was created in 1930s, and this was done by the federal government, and their goal was how can I keep people in your homes? It is better for you to stay in your home than for you to be on the street. Makes sense, right? We all want people in their homes. And so what they did is they said, okay, we need to go evaluate all of the homes and determine which one the government could guarantee that loan to the bank and say, like, no, I think they're paying their loans, like, we'll guarantee it, make the terms that are appropriate, keep them in their home, find something that'll keep going. So, like, cool, let's evaluate mortgages and we will create areas and value those loans. So the banks determined this, who they were going to loan money to. They said, cool, you guys tell us which ones are good, which ones are bad, and we'll make sure we loan people to the right thing. So what happened? Well, you had people go out and were graded at either levels one, two, three, or four, basically an A, B, C, and D. A and B were good loans, like, pretty good. And C and D, not so good, probably not going to do well. The problem is if you put racist people in charge of this, they may start to write things in how they grade their loans and grade people as C and D because they may have obsolescence, poor maintenance, infiltration of Negroes, elevated structures, and mixed races. We'll give you a C and D. Doesn't matter if they could pay or not pay, right? They started segregation with this. The problem is when those groups and those areas started being graded as a C or D, they didn't get their mortgages back. If I don't get a mortgage back, it's going to be harder for me to keep that. And you're like, well, that was the 1930s, Brian. Like things have changed. It's better. Absolutely right. 3 out of 4 of those districts are still low income districts today from the 1930s. All the gentrification and everything didn't matter. 2 out of 3 of those districts are still people of color. So those decisions have been passed on going forward. And we see how redlining is then leading to a distribution of wealth differently, right? What is the biggest way that you can pass on wealth? Home ownership, pay it off, and it's given to my kids. Well, if we start redlining, we call every place in with low socioeconomic and racial disparities, right? And we say, no, we're not going to pay for your loan. You're not going to pay for your house. You can't pass on that wealth. So white people pass on wealth, and communities of color are unable to pass on health or wealth because they are unable to pay for and get loans for their homes. So let's look at how this affects. So does anyone know what city this is? And this is looking at the grades on the left of the Home Owners Loan Corporation. Graded A is white and then D is black compared to tree cover. Tree cover, the darker blue it is, the more trees per area. The whiter it is, the less trees per area. Anyone know what city? This is Los Angeles. So this is Los Angeles, and if you'll notice, there's more tree cover in the A and B districts, and there's minimal tree cover in the C and D districts. So when we talk about heat exposure, we talk about green infrastructure and investment in the communities. It's not happening in the areas that were redlined. Communities of color. Anyone know what city this is?
Is it Chicago?
It is Chicago. Exactly. We see the same pattern, right? So it's not just LA and Chicago, right? It wouldn't be every city in the United States. Anyone know this city?
New York?
Absolutely. 3 of our largest cities, right? These practices over periods of time, it's not just, oh, well, who lives there, but the green cover. Does that affect climate change? Does that affect things? Absolutely, right? If we have more green infrastructure, that's better. The good news is when we got to the 1950s and 1940s, we said, you went to war, you served in, all veterans will get a good VA loan so you can live in your house unless you're of color. We're not going to do that for you. Again, another disparity, right? Another branch where we start changing how we're going to do this. Infrastructure disparities, right? 1950s, we said, hey, let's build a freeway system. Why do we build a freeway system? So we can move military across the country rapidly. That's really what it comes down to. If you look at all the freeways, they go to large military bases and connect them. Well, where are we going to put the freeways? We're not going to put it through the A and B areas from the HOLC. We're going to go in the C and D areas. We're going to go through communities of color. We're going to go through these poor, sacrificial areas, and we are going to build our infrastructure. The good news is we in the 1960s, we're going to have a Fair Housing Act, and we're going to make sure everyone gets treated the same. Well, that didn't really work because it took until the 1990s to early 2000s when the Federal Reserve Bank finally decided that they would actually go after predatory lending practices such as these. And people were still using those red line districts, those graded A, B, C, and D up until the 2000s. So this has been built into the real estate manual, built into the bank manual for years. And the problem is, right, we saw that discrepancy between global north and global south. Whites produce more air pollution and receive less air pollution in terms of exposure, secondary to where they live, secondary to that green space. So again, another disparity on who's seeing what and where they are, partly due to infrastructure, partly due to redlining, partly due to where we put in our petrochemical plants. We're putting it in places that are redlined. So what's environmental justice? Well, environmental justice is kind of the climate justice movement, and you mix that with the environmental movement. So we have our climate with the equal rights movement, right? So you have kind of a blending of this. And this started in the late 1970s. And it started in a place in North Carolina called Warren, North Carolina. Warren County, North Carolina, is a predominantly black county and is one of the poorest counties in all of North Carolina. And a couple is driving in the backyard and they're like, what's going on? They're in the back country and they're like, what's this like nasty stuff? And there's two guys like dumping it in the side of the road. Well, it's these PCBs, which is a polychlorinated biphenyl, which causes skin lesions and many cancers. And so companies and industries were seeing that there was going to be some federal legislation that they would have to mandate these toxic chemicals and started dumping them. People were driving across from from Virginia into North Carolina and starting to dump chemicals on the side of the roads in the backwoods, especially in Warren, North Carolina. Well, this came up and people were like, uh-oh, this isn't good. These guys, the people that were dumping, the companies were found guilty and they were doing it in 13 different counties in North Carolina. So they said, cool, this is done. We figured it out. The state government of North Carolina said, well, there's a lot of toxic stuff. We got to put it somewhere. We'll gather it up, we'll clean it up, but we got to put it somewhere. Where should we put it? Well, people started saying like we shouldn't be putting it in in more North Carolina. And the state government said, we're going to put it in Warren, North Carolina, our poorest, blackest county, right? This is our sacrificial county, all the negativity. Protests started happening, and the people started getting together in Warren, North Carolina. And they said, this is ridiculous. We need to take care of it, right? A predominantly black community, we're trying to stand up for ourselves. The good news is we have a white mayor and a white sheriff and a white city council. And they said, how are we going to make a difference with this? And they said, we need to be able to vote the right people. So they put in a huge voting drive, signed up just about everybody in Warren, North Carolina that was eligible to vote. And then they went back and were able to vote in and now have a black mayor and a black sheriff. And still to this day, as they've tried to advocate for their county, is one of the highest voting percentage counties in all of North Carolina. But they did it through change, starting from an environmental component mixed with the justice component of equal rights, blended together and trying to advocate for their county, right? When we talk environmental justice, we have to assess the disparities, right? Why are there these disparities? Why are there these health risks in certain redlined areas? Why are they doing it? Well, they're getting overburdened with hazards. What kind of hazards? Well, freeways. We talked about air pollution, the amount coming off a freeway, the heat associated with that freeway. Whether that's industrial zoning, that redlined area, we're going to put a big industrial zone right next to it instead of a park. They're having goods and services and trafficked roadways go through. More air pollution, more heat. The hazards are different. There's also more stressors psychologically, right? We talked a little bit about mental health, but when you concentrate these stressors into the areas, crime, violence, poverty, all the isms, right? Social disorder, we concentrate that in these areas as well. Then you add a lack of health promoting infrastructure. Well, what does that mean? Banks, schools, parks, green space, economic structures, basic amenities, libraries. Instead, what do? Fast food, pawn shops, liquor stores, quick loans, right? What we put in at that infrastructure dictates what that community is going to be able to do. So we're having a disparity in these communities that we have to understand. And if we understand this disparity, we can understand that racism truly is a public health issue. And if we really want to address public health, we have to see this as a tenet going forward. And we have to see that this is impacting our entire country and we've created it. And we have to understand that that component is also syndemic, right? If we take climate change and structured racism and environmental justice, and then we throw a pandemic or other stressors, we get an epidemic that's worse than one cause by itself, right? It's a synergistic effect that these are impacting these communities. And we see this in these sacrificial zones, right? All the bad stuff goes there. We put it in the place of low income. We put it in the place of community color. We're not going to invest in those areas. And we'll just call that a sacrificial zone, part of our colonialism, right? We take resources from places we want and we sacrifice things that we don't want, and we keep the good spaces for the colonists. But this doesn't play out in America, right? This is like America? Absolutely. Think of all the fossil fuel energy infrastructures, all the neighborhoods that have petrochemical plants and the respiratory and cardiovascular. Why do you think we see in Black and Latino communities higher rates of asthma? Why is that? It's not just pet dander. It's not just dust from the city. It's impacts from climate. It's impacts of sacrificial zones that we've created. We've seen sea level rise in communities, flooding, right? We look at who's being flooded and sea level rise. Indigenous communities in Alaska are affected. People in the Gulf Coast are being affected. People in Florida are being affected. What happens if a sea level rises in Florida? Wealthy people sell their homes and move. Poor people don't. They can't afford it, right? That resiliency component. We've seen extreme flooding in like Jackson, Mississippi, where you have poor infrastructure leading to clean water mixing with what we call natural disasters or natural tech spills. Just the chemicals that are in nature from a chemical plant roll off and get into the water system just from a rainstorm. And that flooding causes a mixing that leads to more harm. You can't drink the water in your city, right? We've seen extreme heat. We know that there's higher rates of heat related illness in ACAI and rhabdo, all communities of color. And who does that? Our agricultural worker, our construction workers, goes hand in hand. Wildfires hits, right? Who are the outdoor workers? They're being exposed. Lower socioeconomic, those of color. So we're seeing this. All these pathways are leading to harm with the combination of climate change, and you mix that with structured racism. And the kids are affected, right? We talked about 10-year-olds. 10-year-olds can be out in the farms. Whereas what's bad about the farm is, right? It's green space with petrochemicals and herbicides and fertilizers. And these kids with exposures, there's higher rates of SIDS and stillbirth and preterm labor, all in those that have been structurally raced against, right? Not in the colonists, but the other communities. If we look at this, is this just Brian, you spewing this stuff, or there's studies? This is looking at exposures to certain communities of color, disproportionate racial and ethnic, secondary to natural disasters from climate change. There's studies from almost all over the country that people are being affected. This isn't just one part of the nation. This is the whole nation, right? And so if we think about that, we have to think not just climate change isn't disrupting our environmental structures, but it's disrupting our societal structures. And you mix that with illness and allergies and structured racism is leading to big outcomes for human health. And these vulnerable populations are being affected disproportionately for the same exposure. Any questions on our colonialism of ourselves and our structured racism? Cool. Obviously, super depressing, but there are solutions, right? How do we work through this? First thing is talking about it, acknowledging it, and having real conversations, not political conversations, health conversations, normalizing this. And so it becomes an everyday thing that we just say, yes, this is what it is. How do we move forward? We have to look at it as multidisciplinary. Maybe we look at like the food, energy, water, nexus. How do we make sure communities have good food, water access that's clean, energy access that's clean, right? These are resiliency factors that lead to better health outcomes. Whether that's community gardens, whether that's working with local groups, whether that's working to empower people to grow their own foods, grow their own, have their own energy, maybe collect their own water, right? We need to start this young. We need to get kids involved at a very young age so that they understand it and it becomes part of their nature growing up, right? We work this on different partnerships. Maybe we get citizen scientists, community engagement. We get people working in their community, studying that community. If we study communities and we get data, guess what? We make changes in those places. Things that we don't study, nothing happens, right? We're ignorant of. But we have to understand that climate change is affecting food, family, health, jobs, right? It doesn't need to be doom and gloom. It can be health. It can say, hey, we've planted trees in this part of the neighborhood, but not this part. Let's see what people like. How do they like it, right? We need to bring our indigenous nations and peoples to the table. They've managed this planet for years, know how it runs, and didn't cause climate change. But they're bearing an undue burden from this, right? How do we bring them to the table? Classic example right now, large power lines bringing clean energy across the Southwest. We're going to go right across indigenous burial sites. Why didn't we talk to them and they were never brought to the table of where the line should go? Simple things like that. Have them at the table, have them part of the conversation. Bring in the right people. We're going to talk later about divestment of fossil fuels. But if you don't put money and invest in companies, like investing in the slave trade in the 1800s and the London Stock Exchange, you take away money from the people that are producing harm, right? Put your money where your mouth is. Make that difference. Be like, is this really a big problem, Brian? Well, fossil fuel subsidies topped $7 trillion last year. And they're responsible for 1.6 million premature deaths. And yet they still, if we took that money and took that revenue away, we could raise money by the government and not doing these subsidies. We could raise about $4.4 trillion for our government. A lot of these subsidies are implicit. So it's not necessarily like, here's your money. It's like, oh, it's implied. So say for natural gas and oil companies, if you go in and build a natural gas facility, you can deduct a new facility can deduct 85% of the costs on your taxes. It's basically a write-off, right? So anytime they develop, we could, if we, the US spends about 10 to $30 billion on write-offs and incentives, maybe we take $10 million or $10 billion and reinvest it. Just think about what our communities could look like for that. Or we talked about disasters today, right? We talked about the stress of that. The good news is they're only costing more money, right? We're spending in the US government $16 million an hour in natural disasters, and it's only increasing. You can see that's whether that's a freeze or flood or drought or wildfire or cyclone, our costs continue to go up. We need to build resiliencies in these communities. We need to address climate change because that's going to decrease the burden that's being more affected on these communities. And we have to look at it from a holistic component, right? Who wouldn't want to walk in a neighborhood like this, right? It's green, it's beautiful. You have people out, you're commuting, you got a garden. It's cool, right? Because it looks good, but physically it's cool. You're getting clean energy off your roofs. No one's having smokestacks or building stuff like that. You got sustainable transport. You have places for people to walk, be outside, and exercise. And we know that these are healing components, right? People get outside in cool, clean air with a healthy home, a sustainable landscape, walking and exercising, health outcomes improve. Simple, right? We know that with diabetes, heart disease, lung disease, hypertension. Simple. Any questions on that? All right, to sum up, we kind of briefly went through climate change. We talked about colonialism leading to kind of this global north, global south, taking of resources. We've talked about how America, through some structured racism practice, changed our own country and have had created sacrificial zones and how that's leading to health outcomes. But I hopefully mention again, there's hope. There's ways to bring this about, and part of it starts with talking about it, and then we follow it up with good action that improves our communities, decreases exposures, increases our resiliency, and our patients and communities will love it. Any questions?